On this episode of Healthline, we talk about efforts throughout the county to curb smoking and tobacco use, including a brand new ordinance in one of our cities. We'll hear from community partners, health advocates, and county health officials. And we'll meet a local restaurant owner who has successfully created a smoke-free environment for his patrons. Healthline begins right now. Hello everyone, I'm Lyn Vaughn. Welcome to Healthline, the show that keeps you up to date on all matters related to good health. November is the month when anti-smoking efforts kick into high gear. It's when the National Great American Smokeout is held, and locally we have the Nobody Quits Like Georgia campaign. But for officials in the Fulton County Health and Wellness Department, policymakers and advocates, anti-smoking efforts are a year-round effort. As a result of their focus on policy, systemic, and environmental change regarding tobacco use, cities and business owners are joining the smoke-free movement. Whether you're inhaling yourself or taking in someone else's, the dangers of smoking are severe.
We are increasing tobacco smoke-free environments in parks, recs, bars, restaurants, schools, and in multi-housing units across the county.
Through the CDC-funded PITCH program, that's Partnerships to Improve Community Health program, the Fulton Department of Health and Wellness is working to reduce smoking rates. We work with a number of community partners like Georgia State University to reach as many citizens as possible to warn of the health liabilities that accompany tobacco use.
They are working with our community partners and stakeholders to train them around how to understand what policy is, how to do policy briefs. They are conducting opinion polls and air quality assessments throughout various municipalities in Fulton County.
More and more in Fulton County, smoking in public places is becoming taboo. For example, the Roswell City Council has voted to ban e-cigarettes and vapor products from parks and public places, and some restaurants have become completely smoke-free. That means employees are prohibited from smoking outside, even on their breaks.
They're trusting you to come into your restaurant, and they're ingesting what you give them. Letting staff smoke and let people smoke in the building, they're ingesting smoke and they're ingesting chemicals.
The general manager of 2 Urban Licks says he hasn't had any complaints about not being able to smoke at the restaurant. Now, to help put all of this in context, I'm joined by Kenneth Ray. He is Deputy Director of Tobacco Policy, Systems, and Environmental Change in the Georgia Department of Public Health, and also Professor Terry Pahacek of the Georgia State University School of Public Health. He's here with us. Gentlemen, thank you so much for being with us today.
Thank you for having us.
Very important topic to discuss. First of all, let's tell our viewers what we mean by policy, systems, and environmental change.
A policy system and environmental change are the properties or the key components of keeping the community safe. A policy is basically what it is where you restrict smoking to protect the public's health. A systems change is, how do we provide health care to the public, and what system does an organization have towards improving the health outcomes of people? So how can we improve the system of delivery of health care to people, and as it pertains to tobacco control, to improve their ability to quit? And in environmental changes, removing ashtrays from in front of buildings, and or removing advertising in front of convenience stores that promote tobacco use and promote the product of using the tobacco product.
So attacking the problem from all sides.
All sides.
Okay. What are the statistics about smoking use in Fulton County?
Well, in the state of Georgia, 17.4% of the adult population smokes. In Fulton County, it's 13% of the adult population. So the Fulton County residents fare better than most municipalities in the state. But when you look at particular populations such as males, African Americans, people with low socioeconomic status, people who are uninsured, people who receive Medicaid. Smoking rates are well higher than 13%, and in some cases higher than the state or national average.
Okay, so it seemed as though they were low. This is still better than it was many years ago. Is that correct?
It's better than what it was many years ago, but it's still, we have, 13% of the Fulton County population equates to about 100,000 people. 100,000 people with health care costs attributable to tobacco use could lead to millions or billions of dollars.
Professor Pohacek, what do you know for sure about the cost personally and in the business world about the dangers of smoking?
Well, first of all, smoking is one of the major drivers of healthcare costs, both in the country overall or locally. What is even more of concern, as Kenny was just talking about, is the low-income populations, the people on Medicare, the people on government-sponsored types of programs. They smoke at higher rates, and they are producing excess cost, both in long-term disease like heart disease or cancer, but on many short-term types of things, such as greater visits to the ER, or asthma visits, or other types of things that are driving up the cost for all of us. So putting money into prevention is a good investment.
Okay, so Georgia State University is working on this with help from the Fulton County Pitch Program. Is that correct?
We are helping the Fulton County Health and Wellness collect data on public opinions, because involvement of the public is necessary to change the policies. Policies don't come from the top down, they come from the bottom up. It's what people do that helps change the policy. They have to want things to be different, and people really do. What we're going to do is help the policymakers understand how the local people really do want smoke-free environments. They want to be protected.
Well, how do we get that message? So many people have quit. How do we get that message to that tough percentage that just is hanging on to the habit of smoking or using tobacco?
Well, education campaigns are important. People need to know that there are resources available to them to help them quit. We have local resources within the Fulton County hospital community and the clinic community, but we also have the benefit of the Georgia Tobacco Quit Line. And so there's various resources that will help people to quit. But getting that message to them and getting it to them in a repeated fashion where they hear it more often than not is where we're trying to go.
Okay, so we collect the data, and how do we use that data to formulate these education campaigns?
We'll be working with the Fulton County Health and Wellness through multiple channels to get the information out, not only to policymakers, but to the public, to the community groups, and to people to learn more about the risk of smoking and the benefits of both smoking cessation and smoke-free policies. One of the things is there's a lot more on the media now with the CDC Tips campaign and with other types of national campaigns. So people are broadly hearing the message. What we need to do is help them find the resources to respond to the message. And that's why we talk about like the quit line. When people hear the message, get concerned and want to quit, we need to help them do that.
How can we, as family members and co-workers, how can we help with the work that you're doing?
Well, you can encourage, if you have a tobacco user in your family, and in tobacco use is the definition is smoking, ingesting, inhaling, and all the products that are out there now. So if you have a tobacco user in your family, I encourage them to quit. Tobacco use is the leading risk factor for chronic disease in our state. And we have at the state health department, we talk about it all the time. If we could reduce tobacco use by half, we could reduce chronic disease by half.
Wow.
So encourage your loved ones or your colleagues or friends to quit. We know it's hard, it's difficult. Quitting takes practice, but there are resources available.
Well, I can speak on that personally as a former smoker, quit back in the 1980s, thank goodness. But now you see the young people picking up these e-cigarettes and trying to find alternatives to the tobacco cigarettes. How is that impacting the efforts to get a change brought about?
I'll
You can defer. It's quite all
One
right.
of the main things that Georgia State University is doing, we have one of the largest grants in the nation to study these types of issues. We're one of the 14 focused research sites in the nation to study this issue. We're seeing disturbing trends. People see these new products as a solution, and we wish they were a simple solution. The warning flags are that our adolescents, our high school students, and our young adults are now using them, but they're using them along with other tobacco products.
Wow.
And even more of concern to us is that they are now starting to use these new vaping products to smoke marijuana and other compounds. That's a surging rate we're picking up around the country. All of these things lead us to the warning signs that we're trying to end addiction, end tobacco use, end the use of nicotine in our youth. People don't realize that nicotine damages the brain in adolescents and young adults. The brain keeps developing during adolescence on up to the mid-20s, and using nicotine permanently damages the brain and its ability to function well. So there's no way that we need to allow what is happening to keep going. We need total prevention, not just prevention of cigarettes.
Now, something I learned a while back is that long-term smoking affects your eyesight. Is that right? Can affect your eyesight in the long term. Is that right?
Yes, our 2014 Surgeon General report that came out in January 2014 I found a bunch of new things. One of it was that we've known for a long time cancer, heart disease, many diseases, but it also causes blindness. Something else people weren't aware of that we came out in this latest report: smoking causes diabetes. It doesn't just make the treatment worse, it means that the pre-diabetic moves toward full diabetes faster if you smoke. So there's a lot of things in tobacco smoke that go beyond heart disease, cancer, lung disease, all of which are terrible, but there's so many other things. What we say is it affects every organ of the body, and the sooner you quit, the sooner you start reversing that damage. I'm very proud of the fact that you quit now. It is decades ago. That means your body has had decades to repair the damage.
Right.
And your rates of risk go down rapidly so that you're much more like a non-smoker now in terms of your overall risk. We want everyone to be like you in enjoying the benefits of being able to get away from that excess risk.
Well, that is fine advice on which to end our segment. I tell you, we could go on and on about this forever. A nasty habit, a smelly habit, and an unhealthy habit, which is even more important, and we want to thank you. Thank you, Professor Pahacek, and thank you, Mr. Ray from the Georgia Department of Public Health. It's been a pleasure to have you guys with us.
Thank you for having us. Thank you.
We'll be back in a moment. Hi, welcome back to Healthline, everyone. We're discussing efforts to combat tobacco use and create smoke-free environments by the Fulton County Health and Wellness Department and the groups collaborating with its PITCH program. Now, joining us now to continue the conversation are Eric Bailey. He's Government Relations Director at the American Cancer Society. And we also have with us Ms. June Dean. She is Senior Vice President of Public Policy and Health Promotion at the American Lung Association. And I'd like to welcome you both to Healthline.
Thank you.
Glad to have you with us today. We'll start with you, Ms. Dean. Tell us about the American Lung Association's local efforts to help people kick the habit.
Okay. Well, we have a suite of programs under the umbrella of Freedom from Smoking. And we have in-person clinics that are held at Piedmont and Northside hospitals that are readily available for folks. We have an online stop smoking program called ffsonline.org, and we have a helpline that you can call, 1-800-LUNG-USA, and talk to a respiratory therapist or registered nurse about quitting smoking. we have a lot of help for quitting smoking. And we also have something new called the Quitters Circle that we developed with Pfizer Pharmaceuticals that works from an app, and you design your own quitting plan.
Wow. That ought to appeal to the youngsters.
Yes.
The young people among us who are picking up the habit, unfortunately. And what about your Nobody Quits Like Georgia campaign?
Nobody Quits Like Georgia is our new best thing. It's comprised of about 35 partners from around the state, and we've sort of pooled our resources to put together a campaign that will give people a lot of opportunities to quit smoking and understand why they smoke and why they may need help. We know that people quit smoking several times before they quit for good. So if we can encourage a lot of quit attempts, then we're going to have a lot of successful quitters.
Awesome. And Mr. Bailey, the Great American Smokeout is the granddaddy of all of these campaigns.
Sure.
Tell us about the American Cancer Society's Great American Smokeout held each November.
Sure. So obviously we're proud of that event. That is the day in which we encourage smokers to stop smoking, and obviously encourage kids not to pick up the habit to smoke. It's also an opportunity, though, to talk about the state of tobacco control in your state and in your community. And obviously with tobacco control could be better in the state of Georgia, we want to make sure that we emphasize the status quo with that and talk about how we can improve tobacco control.
Well, before I get to that, what's the messaging on the Great American Smokeout Day? You ask people to quit for one day, is that correct?
Yes, for one day. And obviously, as June just conveyed, it takes more than one time most of the time, but that's a start. Reducing consumption is not just quitting sometimes. Sometimes it's just being able to start again to not smoke as much until you can get to the point where you can stop the habit.
Okay, so how would you like to see, what kind of policies would you like to see Georgia enact to help with the work that you do?
I mean, obviously, currently right now, we have a state smoke-free law that pretty much prohibits smoking in a lot of our restaurants, but it still permits smoking in some of our bars and some of our other adult entertainment facilities, which are workplaces. And so we want to make sure at the state level and the local level that we protect workers and patrons from the dangers of secondhand smoke. So we have the state law, and then we're trying to encourage, again, cities such as the city of Atlanta and the other cities inside of Fulton County and some of our other major cities across the state to enact comprehensive local smoke-free policies.
You know, June, when I was back in the day, and you'd go to a party or a disco or club or whatever, people would light up and no problem. And now when you're out and socializing like that, particularly in my age group, people pull out a cigarette and people look at them aghast and with horror. So how much has it changed, and how much more do we need to do?
Well, it's changed quite a bit, thankfully, but it's still hard for people to quit smoking. If you take the addictive nature of smoking and its habit-forming qualities, that's a complex problem for people. So, you know, you do have to try to quit a lot of times before you quit for good. And it also helps to be in smoke-free environments, to work and play in smoke-free environments. And this state has cheap tobacco. I mean, we have one of the lowest tobacco taxes in the country.
Yes, I understand that in New York, the taxes are such that a pack of cigarettes costs what?
$10, $12 easily. Here in the state of Georgia,
That should help.
Yeah, yeah. I mean,
Help
It does
you quit.
help. It helps a
It
great
does.
deal.
if you include the District of Columbia, where Georgia's ranked 49th
Wow.
as it relates to the excise tax on cigarettes. So the national average right now is $1.60, and Georgia's is 37 cents per pack. Which is really, honestly, just unacceptable, given that we know that the biggest deterrent for youth to pick up the habit is to make sure that the tobacco products aren't cheap products.
So what are the other tactics, if you will, that the Cancer Society is working on?
Well, I mean, obviously we are fully engaged in trying to get some of, again, our major cities to go smoke-free. Right now we are working on a campaign in Columbus, Georgia, to try to get Columbus to enact a local smoke-free policy. And we hope eventually that we can get to the city of Atlanta and, again, Fulton County to get them to enact policies that, again, prohibit smoking in all workplaces, including the bars.
Okay, we're coming. We're going to catch up with the rest of the state. June, what challenges does the Lung Association face with, really getting that last group of die-hard smokers? I know as you get some to quit, we have others, young people coming on. What's the challenge for you?
Well, the challenge is that 90% of smokers get addicted before the age of 18 when they're too young to have developed coping skills or strategies to try to quit smoking. And you add that again to workplaces that may still allow smoking, or places of entertainment that allow smoking, or cheap tobacco, easy to buy. It's hard to overcome that. But there are a few tried and true methods that work with all these programs in terms of helping people quit smoking. And that's what we concentrate on. And one of the most important things you can do is plan to quit smoking and make a plan, make a commitment, set a date, talk to your friends, your family, tell them, ask for support, maybe talk to your doctor. Look at when and where you smoke and what you're doing, because you'll see a pattern, and that'll help you with making a plan as well.
Okay.
And just really quick, one other initiative that we're working on, obviously, is the funding piece of it. If you look back before 2006, the state appropriated a lot more money towards tobacco use and prevention control than it does currently. Right now, we spend about less than 2% of the CDC's recommendation on a comprehensive tobacco use prevention control program. So obviously there we want to be able to increase that funding so that our health departments can do the work in the community that's needed to be done.
Okay. Well, I learned earlier in the program that one restaurant owner has forbade his workers to smoke during their breaks. How unique is that at a restaurant here in town? Is that something new that you've heard about?
I'm not surprised.
Well, when
I'll
you're in a
say
restaurant,
that.
the last thing you want is a waiter to come up smelling like smoke serving you your food. So, yes, that sounded like that would be an initiative that would also help.
Yeah, I mean, the main goal is to eliminate the secondhand smoke in enclosed areas. We always say, while we would like smokers to quit smoking, don't get me wrong, this smoke-free initiative is really about protecting people from secondhand smoke exposure. So that's the main goal.
Thank you so much, Eric Bailey with the American Cancer Society, and we have June Dean, who is with the American Lung Association. Thank you so much for being here, and thank you for all of the good work that you both are doing.
Thank you.
Let's take a short break, and when we come back, Health Services Director Dr. David Sarnow will share his thoughts on this subject. Back in a moment. And now, here's Dr. David Sarnow with some final thoughts on the topic of this health line.
Hi, I'm Dr. David Sarnow. Fulton County is focusing on reducing smoking and tobacco use, which are among the deadliest health threats we face. About 480,000 deaths in the United States, as over 10,000 in Georgia each year, are attributable to cigarette use and secondhand smoke, according to the CDC and the Georgia Department of Health. But we have an opportunity to change this pessimistic picture because tobacco use is also the leading preventable cause of death in the U.S. That's why we in Fulton County are working with our community partners in the PITCH program to implement evidence-based, cost-effective strategies that are proven to work in the fight against smoking and tobacco use. First, we are collecting public health data, taking opinion surveys, and performing air quality tests to educate officials as they consider smoke-free ordinances and to form a baseline for targeted prevention efforts. Second, we discourage people, especially school-age children and teens, from starting the habit by warning them about the serious health dangers. Third, to help smokers quit, we're promoting websites and mobile apps designed for teen smokers, as well as the Georgia Tobacco Quit line that provides free counseling, support, and referral services. With these strategies, I believe this is a fight we can win.
Indeed it is, Dr. Sarnow, a fight we can win. Now you can learn more about these efforts by emailing the Pitch program at pitch.grant@fultoncountyga.gov. To find out more about the services of the Fulton County Health and Wellness Department, call us at 404-612-1211. We thank you again for watching. We will see you next time on Healthline.